Hello everyone. I am just go over some hormone questions, some, lab work questions, peptide questions. So, hello.
Hello.
Hey,
We're trying to see if sideways is better or no, then we're opposite. Okay,
How
there
are
we
you
go.
guys?
I'm good. How are you?
Good. You having a good Friday?
Oh, yeah.
except for 6 o'clock meetings.
Thanks, Courtney.
I told you this would be a good time. Everyone's off of work. Um, so we just wanted to come on here and talk about, a lot of people, um, we're like a telehealth based, company, so it's kind of hard to get to know us until your initial appointment. So I think it would be helpful to kind of talk to our patients a little bit so that they can know who we are, what we do, and how we can help them essentially.
Absolutely.
And so I think it would be good to just kind of talk about each of our individual journeys and how we got here and introduce ourselves. So I'll let you guys go first,
All
not
right.
to put you on the spot. Um,
No, I am Brittany Persland, and I've been a nurse practitioner for 30-ish years or so. Worked emergency medicine for about 15 years and have been working exclusively in hormone optimization for 6 or 7 years or so. And I started this because I really love doing it. I feel like we help people so much, and throughout this whole journey we have both seen how so many providers are doing it wrong.
mhm.
So we wanted to start this company because we want to do it right. We don't just want to offer a couple of things. We want to offer really comprehensive care. So that's how we ended up here.
Yeah.
Yeah, I'm Nick Persland. I'm the CEO of the company. I spent a couple of decades, if not more, in law enforcement, but I've also been on HRT for about 17 years. I've also worked in HRT companies as a vice president and now started our own company. And when we really started talking about, hey, should we do something on our own? We started writing a list of what are the pros of the things we've seen, what are the cons of the things we've seen. The pros were one. The cons were dozens of things, and we can go in depth in that. But there's a lot being done wrong in the HRT world and the longevity space, which I think is really coming along pretty well. The longevity space more. HRT is HRT, right? It's being done right or it's being done wrong, and that's easy to explain. The longevity space is a little more nuanced, and it takes a little more trial and error with people that have actually done some of these things to say, hey, this is my experience, this is what the science says, but this is my experience with it. Some of it is great, some of it's yeah, up to the person, I guess. But we try to do both, and I think we do it better than anybody else. I think we do the longevity and the HRT and the wellness programs better than anyone else.
And part of that reason is because of Courtney. So
Well,
now
thank
I'll
you
let you
guys.
introduce yourself.
Yeah, I'm Courtney. I'm the wellness coach or nurse that you guys see posted by No Limits. I started as your guys' patient, which is,
Yep.
really cool to come full circle. I've had my own kind of series of health issues and then my journey back to health. And navigating that on your own is really, really difficult, even for me with my medical training. And so, I think for me, just helping patients not go through what I went through before I found you guys, is really important. So, I help with supplements, I help with any, adjunct therapies. I'm a big biohacker, big into longevity. I do IV concierge nursing. But, I started just like you guys in emergency medicine. So we've really seen the full spectrum of healthcare. And so, it's good experience to have just, for, life experience treating patients. And so I'm really grateful that I started off in emergency medicine as an EMT. And then, my goal is to just, like I said, help people navigate all of this, and help people find adjunct therapies that work, you know. The medications are great, but doing supplements and other biohacking things, exercise, nutrition, you really couldn't be in great health without those things.
Right.
And so that's some of the things that I'm responsible for within No Limits. When I have a coaching patient, we go over their labs, we go over all of the medications that they're already on, what supplements could benefit them, you know, workout plan, nutrition, lifestyle changes. We go through the whole list of things. And so it's a really holistic approach, with all of us working together on a patient. And it's been going really well. We've had great success with a lot of our patients. So I'm
I
very
agree.
excited.
And Courtney, you've come a long way, from when you started with us. I mean, you've lost some great weight. I mean, your
Mhm.
skin is beautiful, your hair is beautiful. I mean,
Thank you.
we have come a long way with you. And, there's a post in our Instagram of your before and after, and it's really amazing. But, you know, part of our goal is obviously to help people feel better, look better, be better, live longer, and have functionality longer.
Right.
But we also want to help people reduce those diseases of aging. We don't want you dying from a hip fracture because you have osteoporosis. We don't want you getting cardiovascular disease, so you have a heart attack or stroke. We want to prevent these things. And so much of medicine, well, all of medicine pretty much, is sick care.
Hmm.
It's not wellness care. It's not preventative care.
Right.
So that's, one of the main things we wanted to do when we
And
came
also
here.
education. Like,
Right.
Courtney,
Hmm.
as an RN certainly knows her stuff, but we try to educate every single person exactly what we're doing and why we're doing it, and do some research on your own. The best patient is an educated patient. If you're just throwing things at somebody and they don't know what it is or how it works, there's always patient involvement, right? And if you're not doing the work yourself, right, there's no magic pill, there's no magic shot, there's no magic lotion. You have to do a little work yourself. I mean, you're a perfect example. Perfect example.
Yeah, I mean, I lost, with your guys' help, I lost 50 pounds, which is huge. I mean, that means so much pressure off my joints from a
Yeah.
longevity standpoint. I'm more comfortable, as a nurse, I'm on my feet all day. I can move better, work out better. And I think sometimes people get into this cascade of, health issues, which for me, it was kind of that as well, where my hormones were off. I was on birth control. I had all this weight to lose, and you kind of get stuck. Like, where do I start? What do I do? Who do I reach out to? And you don't, when you're 50 pounds heavier, for me, like, I didn't feel great about going to the gym, and you just kind of
Right.
feel like you need a little push. And so I think, doing all of those lifestyle changes with the medications really helped me because, now I'm just, I feel great. I'm not in much pain anymore. A 12-hour shift to me is nothing. And so it's really awesome. I mean, I go work out after work, which for me was unheard of. I would leave work every day just exhausted. And so getting
I
to a place where, I
go
just
ahead.
feel really good is,
Yeah.
that's invaluable, to feel good
Of course.
every day
Yeah.
I
consistently.
have this talk with guys every single time, and they're like, Nick, I don't want to go to the gym because I go to the gym and I don't see any results. Like,
Hmm.
I go to the gym 5, 6, 7 days a week, and I'm still overweight, and I still have no libido, and I still have no energy. So
Right.
when you don't see results, you are not going to be motivated. Period. So when you get your hormones in check and you start doing some stuff to get your motivation up, when you start looking in the mirror and you start seeing a change, uh, boom, that's motivation, right?
Hmm.
Yeah.
Boom. I mean, you are going to be all right. Now I need to change my diet. Now I realize what they're saying. Now and boom, you get them on the diet, you get them on the exercise, maybe some peptides depending on what their situation is. Get their hormones right, and boom, you have a coordinate.
And, I'll say when I've learned from some of the best in the world, docs that are on the cutting edge of hormone optimization. So Again, like I said, there's so many people out there doing it wrong. And I used to think that that was really just men, but we do both men and women. And we have had a huge influx of female patients, much to our surprise, because it's being done just as bad, if not worse, for women. I have women
Mhm.
all the time that come to me that have no idea they have PCOS
Right.
because their provider has no idea how to diagnose it. Even if they did diagnose it, they don't know how to treat it. They don't know what it is really. They think, oh, well, you only have PCOS if you have cysts on your ovaries. Well, that's not true,
Hmm.
and we see postmenopausal women on teeny, teeny, tiny little doses of estrogen because providers are afraid of estrogen,
Hmm.
and you're really doing your patients a terrible disservice, by being afraid of hormones. So we're
Right.
not afraid of hormones. We want hormones really good and high bioidentical hormones. Just to be clear, we don't want to use synthetic hormones, but optimizing estrogen, progesterone, thyroid, testosterone, all of these things are super important, even before
Absolutely.
the weight loss.
Yeah, and just to, reinforce how great you guys are, before you and I were working together, I mean, I've sent and trusted you guys with my family members and
Yep.
friends, and you have gotten many of them feeling 10 times better. And so, that's a big compliment to you guys because, everyone wants to be able to feel good about sending their family members or their loved ones to
Sure.
somebody and knowing that they're in good hands. And so, I had, no reason, to, you know, I think for me, my family members, I was doing it myself. I was trying to motivate them and, help them because they're not medically trained and they're very smart people. But, even smart people navigating this healthcare space, like Brittany said, the providers wouldn't even draw her blood, she commented.
Yep.
And so that's what they were dealing with as well. So then for them to go with you guys, you do a comprehensive panel
Yes.
and in a couple months, they were, losing weight, feeling great. And so that's really, encouraging to see. And so do
Well,
you want to
on
go
that,
over the sign up process? I think that would be helpful for people just so that they know like, what's going to happen with their lab
yeah.
work and their initial appointment.
Yeah, so I was actually going to kind of tag on to that with labs. We do comprehensive labs. We don't just look at your testosterone and your estrogen and your PSA. We look at your CBC and your CMP, prolactin if we need to. We can do as much testing as people want. We have everything, but we want a really good comprehensive base because we do catch things. We've caught patients with idiopathic thrombocytopenia, which can be potentially life-threatening. Prolactinomas, diabetes, all kinds of things.
Mhm.
So that's part of what sets us apart is that we do comprehensive testing. We don't just care about your hormones. We want to look at everything. So sign up process. So it's super easy. You can either email us info@nolimitsmedical.com. We'll be happy to shoot you over the enrollment form. You can also go to our website, nolimitsmedical.com. You can sign up for a medical appointment or you can sign up for a medical and coaching appointment, which I highly recommend because Courtney
Absolutely.
is amazing. She has tons of patience for her patients, and walks you through so much stuff. So it's really, really valuable to have that coaching in addition to the medical. Once you sign up, we'll order labs for you. Once those labs are back, we'll get you scheduled with one of the providers. All of our patients have a 1 hour video appointment with the provider. And we want to make sure that we have time, that we're not rushing you. We're not doing these 20-minute appointments, just to work like a factory. We want to get your history. We want to hear your goals. We want to know what's going on with you. All of our plans are personalized for the patient. There's no cookie cutter anything here. Once you have that appointment, you always get a itemized invoice, for all your medications. You have the control to say, hey, I want this, I don't want this, as long as it's medically appropriate. We want to keep things in your budget as much as we can. And then we have a monthly membership. You can either do it with labs or without labs. And then once you're on the membership, you never have a charge for an appointment. Again, we don't want any barrier to you talking to your provider. So anytime you have questions or you want to talk about a new product or you just want to run something by us, you can make an appointment absolutely anytime.
Yeah, definitely. And same stands for me. I have two membership options where I meet with you every other week to follow up, or a little bit more intensive one where we meet every single week and tweak your plan. And it just depends on how you feel like you can handle all of this initially. And so some people start off with the more intensive plan, and then as they go, we kind of back off a little bit because they feel like they have it on their own. Because, we do send the medications to your house, which is really nice. And then some people just want a little bit of help with kind of organizing their medications and doing their first injection. Some of our medications are injectable, and so it's so easy. I've never had a client that wasn't able to do it themselves. Um, but it
That's good.
just, it takes a little bit just to, teach them how to draw it up, how to see where the dose is, where to inject it. But all of my patients have been compliant and excited to do it. They just need the initial education or push. Sometimes they need help organizing their supplements or, knowing what supplement organizer. I mean, I've sent people everything under the sun
Yeah.
to just help them get organized with their stuff. And so, yeah, it's great. I mean, my clients sometimes they wear the glucometer, which measures your glucose, your blood sugar levels in real time. And so I track some of my patients' glucose readings throughout the day to make sure that they're not spiking their glucose too many times with different meals and seeing what foods trigger it. So we can track our clients very closely if that's what they feel that they need. And oftentimes, they benefit a lot from it. So I think
Yeah.
that that's a great option. And then we recently added a bunch of lab work options to our site. Can you guys talk a little bit about that?
Yeah. Do you want me to talk about that? So
You're the doctor.
you don't have to be a patient if you want to just order labs. Of course, we want you to be a patient because we want to at the very least, go over your labs with you. But you don't have to be a patient if you just want to order labs. You can go right on our website and order pretty much any labs that you want, and we'll get it set up for you. And, if you want to have an appointment after you see them and you're like, oh my gosh, I don't know what any of this means, you can make an appointment after that if you like. But we want accessible, affordable healthcare. We know it's hard to spend money on healthcare when we're so used to having insurance pay for everything. But if that insurance pays for healthcare that's not helping you, then it's not worth the paper it's printed on. So we try to keep our prices very reasonable. We want patients with us for a long time. We don't want patients to just come in and spend $1,000 and, be gone in 6 months. We want that phone call in 6 months that says, I feel the best I've ever felt in my life. That's our
Hmm.
goal.
Absolutely.
Absolutely.
Piggybacking off of what we were saying about having your family and the business, as a former Leo, I have a lot of Leos that I know personally in this company, so I take it very, very seriously. I call these folks on a regular basis myself, just as a check-in and say, hey, what's going on? We have a Leo tonight that his wife had a consultation. We have lots of what I consider family members in this company. So everybody in this company is family. I call them just at random. I just shoot them a text and say, hey, this is Nick, Wellness Medical. How are you? Everything going good? Can I do anything for you? And I just like to hear the feedback,
No one's
and
blocked him yet.
no one's blocked me yet. So it's all good. And we're not just HRT. HRT is such an HRT kind of thing, but we are absolutely not that. I mean, we
HRT
we
plus.
are HRT, but we are definitely one of the leading companies in the longevity space, right? Because we're not just doing HRT, we are doing so much more than that. And we have a host of doctors that we use, Dr. Hambright and Dr. Andrenico. We have longevity science, we have functional medicine, and we have doctors that we tap all the time for hey, what do you think about this? You know, it's not black and white. What's your thoughts on this new peptide? Could it work in this situation? We are always doing new research with doctors and with patients and figuring out what is best for you.
Hmm.
Nothing is cookie cutter with us. We are not the 200 milligram, get some anastrozole and we'll see you in 6 months group.
No.
Right.
We are constantly touching base. We are constantly talking about what your symptoms are or what you want. It doesn't even have to be something. What do you want to improve? Like, what's your area of improvement? Is it longevity? Is it HRT? Is it both? You know, they go hand in hand,
Hmm.
but there's a lot of nuance in that, right? There's skincare, there's hair, there's libido. I mean, it all goes. It's a huge profile of things that we can do for you, and we have a bunch of I mean, a pool of PhDs and NPs and RNs that we can tap anytime we want for advice or
And
what do you think? And you're a perfect example. I mean,
yeah, and we
Yeah.
do consult with each other a lot. And, one of the things that was very, very frustrating to me at the last couple of places that I've worked is that we were only doing HRT.
Hmm.
So when patients needed help with anything else, I couldn't help them. So we decided when we started this company, that's not the way it's going to be. We are going to try to help you with as much as we possibly can on telemedicine. There's obviously certain things we can't do, but we try to do some urgent care for our patients. Hey, you just need, you know, some prednisone or whatever.
if you're a member with us, sure, you can have emergency care,
Mm-hmm.
you can do longevity, HRT, you can get second opinions. You know, we have some patients that have some pretty significant issues,
Mm-hmm.
and they don't always understand the diagnosis or what the protocol is for that. So they'll come to
Hmm.
us, lay it out, and we have doctors that we can tap and give them our best second opinion. This way, they at least understand or can make an educated decision on what's going on. So,
Mm-hmm.
I mean,
Yeah.
I don't think there's another medical company out there that does that range of stuff where we're HRT, longevity, emergency care, second opinions. I mean, I just don't think there's a company out there that does it the way we do it. And with coaching from you, I mean, really, we touch every single base that you could possibly need.
Yeah.
And you brought up Dr. Andronico, and he is one of the leading functional medicine doctors in Florida, and we're really lucky to have him in our network.
Great
And
guy.
we tap him all the time and say, hey, we've got this patient with this, what do you think? And, he loves really getting involved. So, and we have, several other doctors. So we have a really, really good team. So we're really
Hmm.
proud of that.
And Dr. Hambright, I mean, probably one of the leading longevity guys out there,
Yeah.
cutting edge type of stuff. So whenever you want to talk about stuff, sometimes the longevity space is very vast,
Hmm.
right? There's new peptides coming out every single day. There's older medications like LDN that are coming back into,
Low
popular
dose naltrexone.
low dose naltrexone that are coming back into popularity, where there's been a ton of research on it, but for some reason it's gone to the wayside. So,
Hmm.
it's always great to have folks to say, hey, what do you think about this? I mean,
Yeah.
it seems to be
I
an awesome thing.
I
And you can
agree.
tap that, and it's
Yeah.
great.
I think for me too, I've noticed that we all talk almost every day. Like if I don't know something, I ask, either one of you guys. If you guys don't know it, then we're talking to all of the other providers. We're in constant communication. So even if, you're one of my coaching clients or you're not, we're always chatting. And I think that really helps re-centralize people's care
Right.
because, you can in Western medicine, especially in the insurance game of referrals and everything, you can really get lost out there by yourself because it's hard to get these people to communicate and it's
Nearly
hard to get
impossible.
them, yeah, it's
If
hard
you're in the
to get them to
insurance world,
communicate.
you're not going to hear about half of the thing, three-quarters of the things that we talk about every single day, right?
Hmm.
And there's so much research saying that these things are amazing and what they can do and switches you can turn on or off. I mean, absolutely. Collaborating constantly is the way that medicine should be done. It
Hmm.
shouldn't be this cookie cutter. Insurance says this, we can't do that. Even though this medication is better, I'm not going to tell you about it. That's not the way we do it. We tell you about every little thing, even if we can't
And
do it or we can do it.
And this is why we don't take insurance, because we don't want the insurance companies dictating to us how we treat patients. We want to
Right.
treat patients with the
Insurance does not want you
most
healthy.
effective, right?
They
Right.
want
Most
you
affordable.
Yeah.
sick. We go the other way. We don't want you sick. We want you healthy, and we're willing to do things to keep you that way. And probably we take people off more medications than we put them on, for
Mm,
sure.
that
Statins. I
is
mean,
true.
all kinds of things, right? People come to us with a laundry list of medications. Most of them are either ridiculous or just unneeded or can be replaced with something much better.
In fact, we had a
Hmm.
patient just yesterday. We're like, throw that in the trash, throw that in the trash, throw that in the trash.
Yeah.
I mean, when you're looking at the research today, I mean, there's so many medications out there that are still being prescribed like they're free, that
Yeah.
are just not effective.
And
Period.
detrimental to your health,
Yeah.
Right.
you know, even
Yeah.
worse.
Like we switch a lot of people from metformin to GLP-1s, which
Yes.
I think is a great
We
decision.
take
And
people off SSRIs.
yep.
We take them off Adderall. These things are terrible for you.
Yeah,
You know, we have
Adderall's the worst. We can easily, I mean, I shouldn't say easily, but there's absolutely
options.
better options for Adderall.
Hmm.
And we have switched many people from Adderall to other medications, and they're like, oh my God, this is so much better.
Yeah.
Because it's
Yeah.
non-narcotic, right? They still can get their focus back and their energy back, same kind of feel, but without that narcotic come down.
And we have,
Love doing it.
like Nick said, we have a really large population of law enforcement guys, military guys, firefighters. You know, those guys. Once word gets out in the department, I think we have like the whole Utah State Patrol in our patients. But you know, they trust us mainly because of him. You know, because he's a retired Leo.
Yeah.
But once they get in and they see how we do things and how we do specialized care for them because they need specialized
And their
care
families.
and their families, you know. So
Hmm.
we have really strong commitment to that population of patients.
And you don't have to be a Leo or first
No.
responder. We give everybody the same care.
Absolutely.
But we do have a passion for that, just like you do with your family, with us. And really, we treat everyone that way. And, we just want to give the best care at the lowest price with the best possible benefit.
Right.
Absolutely.
Yeah.
And so I think we could start by just focusing on HRT and talking about that because we have a lot of fun medications and peptides and stuff that we use. But I think HRT, I mean, like you were saying with patients having ADHD, sometimes their hormone panel kind of speaks to some of those symptoms. And so I think just at baseline, treating their hormones can be completely transformative for these people.
100%.
Hormones are always the baseline of everything, right?
Yeah.
If you got your hormones in a good range where you're feeling good, where things are functioning correctly, where metabolically you're good, then you can start playing with other things, peptides, and even pushing the limit on testosterone to see if you're feeling better or a little more muscle. I mean, there's all kinds of things that can be done, right? But you want to get that baseline hormone level good,
Yeah.
where
I mean,
you're feeling great.
we have a lot of patients that come to us that have no motivation. You know, they're gaining weight. They don't want to go to the gym. They don't have energy. Their sex life sucks.
Poor mood.
Yeah, bad moods all the time, you know. And their primary care just throws them on an SSRI, you know, and
Hmm.
it's so frustrating.
And law enforcement in particular.
Right.
Law enforcement in
They
particular.
don't,
If you get a cop that goes to his primary care and he says, "Man, I just feel like crap," well, here's SSRI.
yeah.
Right.
And they don't even look at the hormones
Nope.
because they don't understand the importance of them. They don't know what to do with them if they do. They're afraid of giving testosterone or estrogen.
And I always say law enforcement, it really is any high stress job. It's
Right.
nursing, it's nursing,
Right.
it's
Sure.
nurse
Yeah.
practitioners, it's firemen, it's people, people in business. It's whoever has this super high stress job, where they're beating down your hormones and those receptors get dulled. Those
Cortisol is through the roof.
cortisol's through the roof.
Yeah.
Those are the folks. I mean, those
Yeah.
are the folks that really get beat down hormonally.
But
And
yeah, you're right. I mean, for men or women, we always look at hormones, whether you're coming to us for anything, because we always want to start with hormones. Because if your testosterone is in the tank, or you're postmenopausal and you don't have any estrogen, or you have PCOS or whatever, a lot of these things, the lack of motivation, the no sex drive, poor libido, all of these things are often fixed with just getting your hormones, and
right.
not just replacement levels, to optimal levels. We hear these stories all the time where people are like, oh, well, my doctor doesn't want me to get over 800 on my testosterone. I'm like, well, how do you feel? And he's like, well, I feel like crap. I'm like, okay,
Yeah.
well, that's not the right place for you, So
We had a guy the other day had 700, right? Okay, 700 seems like a great number, right? but his free test is 7.
Right.
So
Right.
what does the total test mean? It means everything.
Hmm.
The total test means nothing. Free test is everything,
Right. Right.
right? So if your doctor is going by the total test, then he's probably not the right guy for you.
Right.
Yeah. And so I was just going to add, so part of the sign up, I think we mentioned this, is a full hormone panel. And you guys really do look into hormones and the importance of hormones. And so I think for men and women, the way we approach it is definitely a little different, and especially for women, what stage of life they're in.
Right.
Because a lot of our, younger women, they're struggling with hormones and possibly thinking about fertility. And then some of our, premenopausal, postmenopausal patients, they come just because they feel terrible. And so can you guys kind of talk about, the differences there and how you guys approach these different patients?
Yeah, so a lot of hormone companies for men, they won't touch you if you're less than 35. Well, that's really a ridiculous cutoff because if you need help, you need help. It doesn't matter what your age is. Now, are we going to do appropriate care for you? Yes, of course we are. We're going to consider your fertility and consider your lifestyle and all of those things. But just to cut off somebody at an age is ridiculous. For women, a lot of people don't want to see young women because they don't know what to do with them. But
Hmm.
young women have problems too. I mean, so we treat young women, we treat perimenopausal women, we treat postmenopausal women. All of those women need different things, and they need help with different things. And we have different goals for them for where their hormone levels should be.
Hmm.
So we treat everybody. And we also don't just do hormones. We look at GI health, we do GI mapping, we do genetic testing. So, we have people coming to us for a lot of different
Yeah.
things. So it's really nice to be able to say, hey, because of all this you're telling me, I really think maybe we should do a GI map, make sure there's nothing going on there we need to address. One of the other nurse practitioners just told me today, she had a woman come in to her ER the other day that had been around the block with provider after provider, CT scan after CT scan, blood test, blah, 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 all of these things. No one did any GI testing on her and she had all these GI symptoms. She ended up having H. pylori, which
Right.
should be like the number one on the differential. And that's something so easy we could help people with and literally change their life,
In other
Yeah.
you
words,
know?
the first thing they should think about.
Well, one of the first things that should be on the differential, yes. But, providers don't listen.
Yeah.
Not all of them, of course, but so many of them don't listen. And you have to listen to the patient because if you listen to the patient, they'll tell you what's going on
There
most of the
are a
time.
few different models of HRT and longevity. All
Right.
right. You have we're going to do every test under the sun on you, including genetics, all the way down to everything.
And
And
it's going to cost
it's
you
going
a
to cost you
fortune.
thousands and thousands and thousands of dollars.
Right.
And then we're also going to charge you thousands of dollars a month for the medications that we think are going to get you right. Okay. That's one group. And then the second group is the group that is very cookie cutter and only deals with one pharmacy and they only do 2 or 3 medications. And they also charge you a ton of money. So let's say you needed some sort of medication, or I mean, it's simple. They deal with about 4 medications, and if there's a better medication, they're not going to give it to you because they only deal with one pharmacy. So
Right.
boom, they charge you a ton of money and give you a less pharmaceutical that you need. We don't do that. So no matter what your issue is, we're going to give you the absolute best medication for what your symptoms are or your issues are. We deal with a half a dozen pharmacies.
At least.
We regularly go to 4 different pharmacies for a single patient because the medication there is the best medication for this problem or patient.
Hmm.
And you're just not going to find that anywhere else. I mean, you are not going to find an HRT longevity type of company like this anywhere else, period. And I challenge anyone to put us up against anyone else.
And we
Yeah.
decided when we started this company, that is something we're never, ever going to compromise on. We're always going to do 1-hour appointments for patients. We're always going to have multiple pharmacies. We're always going to do personalized care for people. Sometimes it takes me an hour to put in prescriptions, but that's okay because that's the way we want to run this. And if we get too busy, then we're just going to hire another nurse
We have both
practitioner,
worked at other companies
Yeah.
long term. I mean, I have She worked at a company where they wanted to see you to see a patient every 15 to 20 minutes for 8 hours. For 8 hours.
It's terrible
Think about
care.
that. There's
Wow.
no quality of care there. There's no quality of care there, and they only do 3 or 4 medications. So are you doing the best thing for the patient? Absolutely not.
Mm-mm.
They're doing blood spot tests, right, which are
Trash.
terrible, right? They're constantly wrong, especially for PSA. And then you have the other side where they're just kind of sloppy, and they don't have all the pharmacy stuff.
Yeah.
When
Yeah.
we started this, we just said, we're not going to do all that. We're
Right.
just going to do it the right way. We're going to do 1 hour consultations. If you only do 2 a day, right, and the rest is at the pharmacy, then so be it. That's fine.
Hmm. Yeah,
Yep.
and so you guys use bioidentical hormones with our
Yes.
patients. Can you guys talk a little bit about why you prefer those versus, we see a lot of patients on synthetic hormones or,
Yep.
even they come in with their goal to get off birth control or, some people have the pellets that are implanted every so often. So, I think what we do really sets us apart if you guys want to just share a little bit about that.
Yeah. So, you know, many years ago, the Women's Health Initiative study came out, scared everybody about hormones,
Still scares everybody.
still scares everybody, said that estrogen gives you cancer. Estrogen does not give you cancer. There are synthetic estrogens and progestins that do have a higher risk of cancer associated with them. We don't ever want to use synthetic hormones. We always want to use bioidentical. It's what your body recognizes. And to be clear, some people get confused about this. Bioidentical does not mean that it's not made in a lab. It is made in a lab, but chemically, structurally, it's bioidentical to the hormone that's in your body. So your body recognizes it as this
The
is
structure is the same.
right. The
Is it,
structure is
is
the
it
same.
made in a pharmacology?
Yes,
Yes,
it
it
is.
is, of course. But the structure is the same. Now,
Yes,
some of these synthetic hormones structurally are not the same.
right.
In fact, quite different. Uh,
Yep.
but as far as bioidentical stuff goes, yes. If you are on testosterone or estrogen or progesterone or it's going to be bioidentical. Are there other things that we prescribe that are not? Yes, but we're always very upfront about what you're getting, why you're getting, what your goals are. And something, not
And
every
not
medication,
hormones, to be
right,
clear.
not hormones. But I was, I just want to make sure we're always clear in this space. Not everything that we do is bioidentical because not
Right.
everything is hormones and not everything is, when you're in that longevity space, we're dealing with a lot of branched chain aminos. You just have to explain to people exactly what you're doing.
Right.
Yeah.
And the bioidentical hormones are, you don't people come to me all the time and their provider has them on synthetic hormones. And it's terrifying, to see these patients on these hormones. First of all, they're not doing anything for you because most of the time it's not even a dose that's going to do anything for you. They come with like this 0.003 estrogen patch, that's not doing
Yeah.
anything for you. I had a patient the other day that said that her provider would not go over 25 milligrams of progesterone because she was too scared. I'm like, we start at 225 milligrams, for the progesterone. We want good high progesterone because it prevents cancers, breast cancer, uterine cancer, ovarian cancer. So, we want to have the goal of having hormones at a certain level to be preventative. And, if you don't have them high enough, you're not doing the patient any service.
And much like the women's study, there were studies back in the day about injectable testosterone that were
Right.
saying, oh, it causes heart attacks and strokes and all of this stuff.
Prostate cancer.
Completely untrue, completely
And
untrue.
actually having low hormones is far more dangerous
And
than
they went
having
into
high.
the pellet world. You mentioned the pellets. So
Yeah.
let's get into that because there's a bunch of people that, oh, I'm on pellets, I'm on pellets. Well, great. Well, they don't release at a specific time where that's measurable. Like you may get a big dose one day, you may not get a big dose the next day. So you're constantly like this, and you're getting these fluctuations in mood, right? And for women, it's even worse. If you get pellets as a woman, you're going to have serious problems. We've never talked to a woman that's ever had a good reaction with pellets. Never. Men, they're kind of like, they were all right,
A
nothing
lot of
great.
times they get abscesses.
A lot of times they get abscesses, they
Yeah.
pop out.
Yeah.
I mean, we actually have a doctor we work with way back in the day. He was doing pellets, and he's like, man, that was the science. Like that was what it was. Nobody was doing injectable. The pellets were like the the thing that was it. They're just not. And you just got to get away from the pellets, especially as a woman.
Yeah.
And our goal is to have your hormones nice and high and steady. We don't want this thing. So we have a lot of guys that come to us that their provider has them on a ridiculously low dose of testosterone, once a week, once every other week, something like that. And this is all you're getting. So we dose our testosterone and all of our hormones daily. We want your level good and high and steady so that your mood doesn't fluctuate, your sexual function doesn't fluctuate. You're getting good benefit to your cholesterol and your HDL, all of these
I
things.
fought this for a long time.
It took me about 3 years to convince him.
I've been on HRT for 17 years, and I've always been an intramuscular guy, and it's just old school. But when I started seeing my blood work come back, I was like, man, she's right. And it took me a blood work or two to admit it, but she was right. When I looked at my blood work as intramuscular, it was like this. I would see results. I was high. I was low.
Plus, much higher hemoglobin and hematocrit, much higher
my
estrogen.
H&H was high. Estrogen would always have to be touched. Now that I do it daily, 5 on, 2 off, I inject testosterone 5 days. I take clomiphene 2. I don't have any H&H issues. Not that it's a huge issue medically,
Right.
but also my estrogen is always pretty in check around 40-ish. It just works.
And let's be clear about estrogen for men, because this is another thing that people get all upset about. We want men to have estrogen. Estrogen is really important. Estrogen is what protects you against cardiovascular disease, heart attack, stroke, osteoporosis, cancers. It's not necessarily the testosterone, it's the estrogen that comes from the testosterone.
Mhm.
So, we want hormones in a good balance. Are there times we have to touch estrogen just a little bit? Occasionally, very rare. I think we have one patient, that we have to do that with. Most of the time, you dose daily, you dose in appropriate doses. You don't have those problems where your estrogen is sky high and you're, what do they say, crying at
if you
commercials.
are with a HRT or provider who has you on a certain amount, 200 milligrams of test, and they have you on an anastrozole, you should run from them.
Right.
Yeah.
Because
Right.
they're going to crash your estrogen. And listen, back in the day, 15, 20 years ago, when I first started, that was the protocol.
Right.
You
Mhm.
were on 200 milligrams of testosterone. You were on a quarter milligram of anastrozole 3 times a week. They crashed your estrogen, and you just didn't know any better. Now we know that a good high estrogen, 40, 50, 60 is where you should be, and a free test a little higher than that, and bam, you're off to the races. You're going to feel like $1,000,000.
Yeah. If you
Right.
crash your estrogen, ain't nothing going to be working.
Yeah.
And
You
that's
can't
not
build
what we're trying to accomplish.
you can't build muscle.
Yeah.
Your mood is going to be
Yeah.
terrible. Your sexual function is going to be in the toilet. Your
No
libido
libido.
is garbage. So the estrogen is very important, and that's a kind of an educational thing that we have to teach guys all the time. Old school, especially guys in their 40s and 50s that were old school. I'm like, brother, that no estrogen thing doesn't work.
Yeah.
Have you not figured that out yet?
And,
Like,
Yeah.
I can build muscle, but I got no sexual function. I got no libido.
And
All right.
I know we need to take time for some questions if anybody
yeah.
has any, but we want to say that sexual function is really important.
Really.
A lot of providers just kind of poo-poo that and don't really delve into that, especially when it comes to women. But it is important. It's a huge quality of life issue. We put almost all of our guys onto tadalafil because tadalafil has so many benefits, not just for erectile function, but for heart health.
Cardiovascular
Cardiovascular
for
health.
sure.
So, we make sure our guys are on that daily, not as needed, but daily, because that's where you're going
Right.
to get the benefit.
And I
All
think
right.
we were talking about this on a call the other day where, a lot of doctors see erectile dysfunction in a patient, and that is
Right.
a huge marker of their
Right.
actual cardiovascular function,
Right.
which sometimes people, I think, during the appointments are like, oh, why are they asking about this? Like, it can be a
Right.
little embarrassing for a non-medical person to talk about. You and I joke, we all just talk about this all day,
I
so it's
know.
nothing to us. But it is a huge, huge marker of whether you're actually circulating properly. So
Right.
sometimes people will catch, underlying cardiac issues just based off of erectile dysfunction. So, we don't ask these questions, for no
Just for
reason.
fun.
It's a huge, huge
Yeah.
deal. And then somebody commented and said, my mother's dealing with severe menopause and depression. I tried putting her on DIM, but it didn't help much. Could it be her suffering from low progesterone? And this
Absolutely.
is your guys' expertise, really. So,
Yeah, absolutely. She should come talk to us. She's probably getting no hormone support or very little, if any. If she's postmenopausal, she needs progesterone, estrogen, thyroid, testosterone. And that's another thing that kind of gets overlooked is menopausal symptoms. Well, there's a reason you're having menopausal symptoms. It's because your hormones are in the tank.
mhm,
So progesterone is my favorite, absolute favorite hormone to use in women. Every woman can benefit from progesterone. It's a really great mood enhancer. It's great for sleep. It's great for cancer prevention. So yeah, come talk to us because these are the people we love to
A
help.
huge misconception for men is that they don't need estrogen. And a huge misconception for women is that they don't need
Right,
testosterone. Right? These two hormones are both male and female.
right,
Different numbers, of
right,
course, but they're for both. And if they're not right, you're not right.
right,
yeah. I agree. And there was actually a woman that I saw the other day where I work at my drip center, and she was, she's already gone through menopause. I was dripping her and I was like, "You look incredible. What is your secret?" And she was like, "Don't tell anyone, but I'm on testosterone." Because she was in such, I mean, she was in better shape than I was. Like I was like, "Can you give me your arm routine? Like what are you doing at the gym?" And she was like, yeah, I recently, about a year ago started taking testosterone. And so she was like, I can't give you my arm routine because my arm routine is, the exact same. It's just the only change is the testosterone.
well,
And
you were the one that told me that you had a patient come to you, and after they started taking their testosterone, they were like, I feel amazing.
yeah, yeah,
When you get people's hormones right, they automatically feel so much better. They're lighter,
yeah.
libido comes back, and when you're mentally in a better place and you have libido, your whole life is just better, you know?
And
Yeah.
a lot of women deal with postpartum depression. Postpartum depression is treated absolutely completely wrong in the traditional medical world. It's just like women with PCOS need lots and lots of progesterone because a lot of times that postpartum depression is from the progesterone drop off after you deliver. And these women can have really serious depression and it's hormonal,
Hmm.
and people don't know
Absolutely.
how to.
It's a
So we treat
huge
those women
hormone
too.
shift. Yeah, I
Yeah,
mean,
huge.
even for me, like I was on birth control for a really, really long time because that's even their top of the line treatment for women, for acne. And
Right,
so I had no guidance on my hormones. I mean, it was just, they had no other answers other than that as a band-aid. And so then as, a mid 20-year-old woman trying to get off of birth control and lose weight, because
right,
people don't talk about the effects that birth control has on your brain chemistry, on your
right.
absorption of certain vitamins, methylation, your gut
Yep,
health, your choice, even it affects your choice in partner,
right.
and
And
your attachment style.
I've had several women come to me with an IUD and saying that they've tried to go to their OB to get their IUD out because it's causing so many problems for them, and they will not take them
Hmm.
out. It's the craziest thing I've ever heard. I don't know if there's some sort of insurance reimbursement thing for
This is not a one-off. We've had
it.
we've had numerous
Yeah, and
numerous
that's
patients
really
like this.
terrible. It's
Right.
really
And they
terrible.
go ahead and they figure it out one way or another and they get it out and then they call and they're like, wow, I feel so much better.
Yeah,
Yeah, because, as a healthcare provider, we have to give our patients informed consent, and that's what we do with No Limits, is we give them all of the options and all of the information, and that's why on the hour appointment they can sit there and ask all the questions,
right. And
about
we're always
any little
available
thing.
after that.
Right.
They can always message in or always schedule another
I,
appointment.
I always tell people, listen, on the first consultation, don't be intimidated because we throw the kitchen sink at you. When you fill out that form, right, every single thing that you want addressed, we address. So it may seem a little overwhelming at first, but it's up to you to figure out, hey, I want to work on this, I want to work on this, and then maybe you work on one or two things, and you come back to these other things, or you work on them all at once. That's fine. But we are absolutely going to throw the kitchen sink at you and give you every option you can possibly have.
And we are always tweaking,
Absolutely.
we only do prescriptions for 60 days. And the reason that we do that is so that every 60 days we're checking in with you. How's everything going? How are your symptoms? Do you have any questions? Do you want an appointment? So we don't just, throw you out there.
Yeah, I agree. So I wanted to touch on some of the more fun stuff that we offer, because, I'm a big biohacker. I know that you guys are in the longevity space as well. So we do HRT really, really well, but we also do other things really, really well, like peptides. We offer different nootropics. I know that we are all on a whole list of things. So I was thinking we could talk about our favorites and our personal routines, just to
Yeah.
help answer any questions that anyone might have.
Sure.
So personally, I take hormones. I'm 52 years old. I take all the hormones. I take methylene blue, which I love for mitochondrial repair, increased oxygenation. I take NAD plus.
Low
What
dose
else do I take?
naltrexone.
Low dose naltrexone, which I love
Mhm.
for overall reduction of inflammation in the body.
Take
Uh,
some Nat Plus cream and
yeah, I do facial
biotonic
cream,
acid,
glutathione, which is great for getting rid of free radicals and cellular health.
Mhm.
MT2.
Oh yeah, we have a tanning peptide, as you can tell
She's
from,
tan, she's brown,
I love
beautiful.
the melanotan. It's a tanning peptide. It also helps prevent skin cancer. There's two types. There's one that has PT141 in it, which helps with libido, especially for women. But there's also one that just has the melanotan in it, which helps with tanning. So you take a few doses, you get out in the sun for 30 minutes or so, and then you just keep taking it, and you have a tan for as
And you
long
can
as you
get
want.
darker and darker without being in the sun.
Yeah.
Yeah.
Yeah, it was actually originated in Australia as a anti-skin cancer drug,
Yep.
and it works miraculously. It's just they never thought that it could work as an injectable, and that's really the only way it can be done. So, even though it works, it just kind of fell off.
Yeah,
But
providers are very afraid to prescribe injectables to patients. So most providers won't do it, unless maybe it's testosterone, but there's lots of great things out there.
Mhm.
What do you take?
oh
Take
my gosh,
methylene
I mean,
blue, you
wow, I
take,
take a laundry list of things. So my HRT stack is probably about 300 milligrams of test a week. I take 100 milligrams of nandrolone decanate for joint because I do still like to stay in the gym. I take methylene blue. I take liver support. I take
adrenal
adrenal
support,
support, methylation,
multivitamin,
multivitamin. I look over there. I mean,
magnesium,
magnesium every
which is great to
day.
help you sleep at night.
Mhm.
Most people are deficient. We always take vitamin D, vitamin K supplements because most people are
Yep,
deficient in those
yep.
as well.
Yeah.
I always make sure that my vitamins have boron in them. I try to keep my SHBG in check. This way, my free test is in a good range. A lot of people don't realize that SHBG just grabs up the free test or the test. So the lower the SHBG, the higher the free test, but you don't want it too low. So you always want to make sure you're doing blood work every 3, 4 months. Just make sure you're in check that way. And I switch stuff up. So, I'm also on mesomorelin. If there's something new out there, I try it because I always want to give, the people I talk to the best advice I can as far as what I've experienced.
Mhm.
I'm not a medical professional, but if I try it, I always want to be able to say, hey, this is what my experience was. So if there's something new, I always, modafinil.
Oh yeah, of course,
Uh,
modafinil. And
modafinil is a go-to always,
It's my
always.
with your blood
favorite.
work, if your provider is not looking at your free testosterone, they are doing you a huge disservice. You have to look at or calculate free testosterone. And you have to know how to read it because the labs report testosterone and free testosterone in different measurements.
Right.
So they try to fool you and make you
So they
think
use
you're
nanograms a deciliter for total test. They use pictograms for free test, which is a total sham right there.
right.
So if you're going to measure nanograms a deciliter in total test, you should be measuring nanograms a deciliter in free test, but they don't. So instead of being
Yep.
70, you're 70, right?
Right.
So you look, oh my God, my free test is through the roof. No, brother, it's
No, it's
not.
not. It sucks.
So, always make sure you're looking at that good. But going back to modafinil, yes, one of our favorites as well. Absolutely my favorite nootropic. I mean, CMAX and
Yeah.
all those things I think are just kind of the little sisters of modafinil. I think modafinil is a wonderful medication, and at higher doses, has a great
Appetite suppression.
appetite
Yeah.
suppression to it. So you can get the focus and energy, right, and still have your appetite, or you can go up to the 200 milligrams, still have that great focus and energy, and also have that appetite suppression. If you're
Absolutely.
needing that weight control type of deal.
All right. Do we
Yeah.
have time to go through your stack, Courtney? Probably
I think
not.
mine is bigger than hers. I think I take more stuff than she does. I don't know.
I don't know.
Well, okay. So, um, and I just want to clarify too for our listeners, we have nootropics, and other repurposed drugs and medications that we use. And so modafinil is a good example of that. And then the peptides are little, chains of amino acids sequenced together to make your body perform a function, that it would be normally performing, but better on its
Yep.
own. And so they are two different things. And we do them both great. I love modafinil. I take modafinil every day. Um, one pill to sometimes a half, depending on how I'm feeling. I do methylene blue. I do the Macy-Morlin growth hormone peptide in the morning. And then I do my Samoralin injection at night. I do glutathione injection 2 times a week, and
I
then
forgot that one.
topical
I do that one
glutathione.
too. I
Yeah.
forgot that one. I do that one too.
I do the lipo shot, which has some amino acids too. It has methionine, inositol, choline, which those are all great for, energy, hormone balance. It has, I think, arginine and carnitine in it, and then B12. I think that's the combo in the lipo shot. But that's a really good overall shot, especially for women with the inositol. Um, and then I do like a million vitamins. Oh, and I just got the oxytocin today, which is, the intranasal spray of oxytocin, and I feel incredible. I
Oxytocin
mean, that one was
is a
really,
great peptide.
yeah.
Oxytocin should make you feel just elevated,
Hmm.
in a really light, great mood, you know.
Yeah, that's definitely how I was feeling. I took it, and it's funny because I was driving and I just felt like really, really happy, and I forgot that I had taken it. And I was like,
You're like, what's wrong with me?
Why am I so
what's
happy?
happening? Like I'm having such a good day. It's so random. Um, but yeah, I feel great from that. And then I'm on and off the melanotan as well. And then trying to think if there's anything else. Oh yeah, I microdose the GLP-1.
Oh
That
yeah,
was
I
the
do too.
first medication that I got from you guys, the semaglutide. And then I know that we use a lot of the tirzepatide too. But microdosing that has really helped my pain levels, kind of manages my weight. Microdosing doesn't give such an appetite suppressant effect.
Right.
It's just something good. I mean, I even have some people that I know that manage different neurological or autoimmune conditions just on a GLP-1. Some people with Parkinson's that I personally know, or, some people with different various autoimmune conditions. They love the GLP-1s just for that.
GLPs
And then,
GLPs are coming out to really be a benefit for a lot of different things,
mhm,
a lot of different things. And the inositol and choline, people don't realize, is amazing for your liver.
Yep.
mhm,
Like
yeah,
it pushes fat out of your liver. If you have any fat in your liver, inositol and choline is amazing for your liver.
yeah,
And women with PCOS really need to be on a GLP because PCOS is a disease of insulin resistance. That's
mhm,
what it is. So you have to treat the insulin resistance or you're not
right,
going to get rid of any
And
symptoms. So it's
listen,
great for those
having that
women.
in control, you know this, it controls a lot of other triggers.
Right.
Right? It just, as we go on, we're just finding out more and more about GLPs. They're great.
yeah, absolutely. And I do take the low dose naltrexone as well, which helps with my inflammation and pain, in my joints. And then I take 1 million supplements. I mean, I know we all love our creatine supplements and magnesium. I do the NAD precursor supplements,
Oh, yes, we do that
um,
too.
M&M.
resveratrol.
Yep.
NAC.
Yep.
I do some melatonin every night, along with some magnesium glycinate, and then I do more, the precursor supplement that I have has some senolytics in it, and so it's a really good supplement that pairs well with our NAD injectable
Yeah.
peptides
And
because when
we
you're getting the
always
NAD, No,
I
sorry.
was just gonna say,
Go
we
ahead.
always recommend, that's okay. I was gonna say, we always recommend supplements for people, even though we don't really sell supplements. We always
Mhm.
want to give you a good supplement list because so many of those supplements pair really well with what you're doing. If you're
Yes.
taking NAD, you need to be taking the precursor, and you also need to be
Hmm.
taking glutathione. So, we don't just give you a medication. We want to make sure you have the right medications to go with that medication as well, whether they're
That's
supplements.
something else you're not going to find anywhere else.
Yeah,
You're not.
Right.
People are going to put you on that plus and just send you out the door,
right.
Yeah.
right? And not tell you, hey, you should probably also be on glutathione.
Right, because
Uh,
you want to get rid of those free radicals that are produced from the NAD. Even though NAD is great for cellular repair, it produces
there's
free
trash.
radicals, and so you need something to take out the trash.
Exactly right.
Yeah. Absolutely. And so I think that's why we all pair well together because we don't just send you off with your HRT. We're
Right,
really developing, depending on your goals, um, overall lifestyle changes, and then we send a whole supplement list, all of your medications, and then we guide you through that whole process because we can't take lab work every 2 weeks. So we
right,
really are in contact with the client, talking about symptom management. And I mean, even one of my coaching clients, we upped her dose of progesterone to an appropriate dose for her when she was being managed by somebody else. And then
right.
she comes back even 4 days later saying, I slept through the night for the first time in, she can't even
It's
remember when she
so
last had a good
simple.
night's sleep.
It's so
Right.
simple, but
It's simple, but
people are
it's
just
not simple. They're being
people
mismanaged.
are just not educated. We don't learn about this in medical school. We just
Hmm.
don't. And so you have to have specialized training if you want to really understand how to manage hormones. And we
Hmm.
all have really great training. So that's why we're so good at this.
Yeah. And somebody asked for more information on metformin. Um, and so I think we spoke about that just a little bit earlier, but I don't think any of us
Our fans
like metformin. I think for me, there are different things that you can take, whatever you're trying to target with metformin. I know some longevity people like it for, lengthening the telomeres, which I think, you can use the peptides like epitalin for that. We have other peptides that do that as well, or with the blood sugar control and pre-diabetes, I think GLP-1s do it better with less side effects, less effects on the
100%.
gut. And
Yep.
so I think that, metformin is not great because I've never had one patient on it that doesn't have some type of side effect from it.
And it doesn't
Um,
work that great. It
yeah.
just doesn't. People use it because they don't know what else to use.
Well,
They don't.
it's an old school drug that's
Yeah,
cheap.
and they don't know how to microdose the GLPs, which we
Right.
do. So there's much better
This is
options.
exactly what I mean by people getting medications that aren't necessarily the best medication,
Right,
right?
Mhm.
Does metformin work? Yeah, of course it does. Is it a great medication? It's not. Does it have some toxicity? It does. Why wouldn't you just use a low dose GLP that's going to probably do a better job and also give you better benefits in other areas?
right,
Metformin is just an old school drug. Does it work? It does, but it's just not the best medication. If they're getting
Right.
it, it's either because their provider doesn't know, or they're going to someone who only uses a single pharmacy and that's the medication they have.
it's terrible for women with PCOS. It does not help them.
Yeah.
It depends on why you're taking it. That people take it for a lot of different reasons, but I find it to be a highly ineffective medication.
There's other medications that are better. Simple as that.
Yep,
Yeah, absolutely. And I think we are good about, really like doing a plan tailored to the patient. And so we talk them through why it's not the best option, what is a
right,
better option, even what adjunct supplements or activities. So, you are focusing on your blood sugar. What can we do to help you
right.
with that? We'll do the
Berberine is a
GLP-1s.
Berberine is a great addition. It's a supplement. We recommend it for people who want better blood sugar control. It
Lose
works great
fat,
for
build
them.
muscle.
Yeah.
Hmm.
Everybody gets all upset about, oh, well, people just want to build muscle. Well, yes, you want to build muscle. Having good lean muscle mass is really important to your overall health. So, yes, we
Hmm.
want people to build lean muscle mass because that's going to help
Absolutely.
you burn fat. It's going to help keep your joints and bones strong. It's going to help your overall health be better. So, yes, we want people to build lean muscle mass. It's
I
good for you.
agree.
Of course.
Yeah. And when I was in the worst health of my life, I was constantly doing cardio, which is
Right,
insanely inflammatory. I
right.
was a vegetarian, so I wasn't eating enough protein. I was on birth control. And so I think getting guidance on all of this and getting my healthcare and supplements and even just my activities re-coordinated in the correct way, is
Yeah.
so important.
And
Um,
we talk about cholesterol a lot, and we could do a whole other thing on cholesterol, but cholesterol has been vilified for no reason. You want cholesterol, you need cholesterol for brain function, for hormone production. So we are big proponents of carnivore diet, eat good fats, throw the statins in the trash. You need cholesterol. So, this everybody's got to be under 200 or 180 or whatever it is these days is ridiculous.
Absolutely. Somebody said I love berberine and spermidine. Um, and Brittany said that she agrees with this, especially for women with PCOS, which is
We
definitely true.
we treat so many women with PCOS. Most of them don't even know that they have it when they come to us, and it's such an easy diagnosis. All you have to do is look at the blood work and listen to their symptoms. Women can't have really hard time with fertility if they have PCOS. They have a hard time maintaining pregnancy if they have PCOS. So we can help women do both of those things. Become more fertile. So be careful, and also be able to carry a pregnancy because you have to have progesterone to carry a pregnancy if you have PCOS. So, a lot of, again, these things are so often mismanaged in the general medical world.
Absolutely. And even, on one of my consultations with one of my coaching clients, she was dealing with cancer, and I asked her about her, last emotional traumas, dental history, recent procedures. She was like, nobody has ever asked me any of this, but it turns out that she had had insane amount of dental work on the same side that she was having trouble with her, breast cancer. And so it's like, really getting a good picture of health and like you guys said, really listening to the client is so important. It's not, and it's more than just lab work. It's
Right,
Of
more than
course.
just, hormones. It's just really getting a good picture and really coordinating somebody's full health care well.
right.
And so I
Listen,
think you guys,
these guys call Nick all the time. They call him, all hours of the night, hey bro, what do you think about this? So we really pride ourselves on being very available for
It's not
patients.
about numbers
Yeah,
on
it's
blood
not.
work. It's however
That's
you
part of it,
feel, what is going on with you. You can read more into what's going on with somebody in a phone call than you can ever get from blood work. I mean,
Right.
mouth care is gut care,
Mhm.
right? If you're not taking care of your mouth, you're not taking care of your gut.
Courtney taught
Right.
us that today in her
Sure,
post.
Yeah.
100%. And there's a million things you can do to make that better, right? And just
Yeah.
change products. I mean,
Right.
but listen to what people have to say. I mean, when people tell you what's going on with them, you don't necessarily need blood work. I mean, it's always great to have, but you can tell what's going on.
When we
Absolutely.
went to the dentist a few weeks ago, Nick gave our dentist a lecture on alcohol and mouthwash, and why is she recommending that? It's terrible for you.
I didn't
That's
think she
true.
appreciated it, but she got the lecture anyway.
Yeah, my dentist and I actually had a conversation like 3 years ago about me not doing fluoride or alcohol, and then we had kind of a debate about it, and then I came back a year later, and she was not using any of that in her
I
practice.
did the
Um,
same exact thing, girl. They were like, "Oh, do you want the Florida?" I'm like, "Nope." "Do you want them out?" "Nope." "Why?" I'm like, "Well, what do you mean, why? Are you not looking at the research?" They're like,
right,
"What?"
absolutely.
I'm like, "So
And so
maybe
I
when I go
think
back
being
next, they won't do it."
advocates,
Yeah,
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 I think being
absolutely.
advocates for these patients,
The-
and having to navigate all of this, ourselves makes us better to, help other people. And
Right.
so I just want to open the floor up for any other questions that people might have
I know we're going
before we wrap
on and
things
on.
up. I know we
It's
get so
fun to talk about
excited.
this stuff.
Yeah,
You can easily get
absolutely.
lost in a conversation about it.
Yeah,
But,
if anyone has any questions,
it's like
just let us
the
know.
old saying goes, if you do what you love, you never work a day in your life, and we really do love what we do. We love having patients and answering their questions and making them feel better. And we're really dedicated to that. So, this is part of what makes us stand out from other clinics.
Absolutely. And you guys can always message me or the No Limits account.
Yep.
or Nick and Brittany if you want more information. We're happy to help. And, even if you want to send your family members to us, we can help them navigate the website. So, yeah, if you guys need anything, even after the live is over, please send us a message and we'll be happy to help in any way that we can. Um,
Absolutely.
yeah, but it was great talking with you guys.
Yeah.
I'll talk to you guys
All
later.
right.
I
Well,
hope you have a good rest of
thanks
your
for putting
night.
this together, Courtney.
Of course. Bye, guys.